Dr. James Nessing, your Macon, Georgia chiropractor. We're here this afternoon with Andrea. You've come from South Georgia to come see us today. Tell me about what's bothering you today.
Spot on my neck and my arms.
Your shoulder.
The shoulder that you've been working on.
Okay.
And then and my ribs.
Okay.
Yeah.
All right. All right. You've been doing some stretches and exercises that I've given you to do at home, correct?
Yes, sir.
Okay, and that's going all right for you?
Yes, sir.
Okay. What would you say your pain number is 0 to 10, 0 being none and 10 being unbearables for this general area today?
It's about 6.
About a 6. Okay. All right. So let's just check you. Let's see what's going on with you. I want to check your neck first. I'm just palpating first. We're just checking the area here. In your lower neck, you feel that spot?
Yes,
a little
sir.
sore, isn't it?
It is.
Okay, so the lower cervical level here, this joint and nerve control this part of your shoulder. Not quite as bad on this side, right?
No, sir.
Okay. Let's just check your movements. Turn your head left. All right, so you turn about 70 degrees, 80 is normal to the shoulder. Go to this side. You're about 70 to this side, 80 is normal. Does this bother you through here at all?
Yes.
Okay. All right. If we lean you back on the right and push down, do you have any extra pain through here? Any extra pain in your neck or through here?
My neck.
Right through here?
It's right here to here.
Right from there to there. Okay. So when we do compression on this side, we're relaxing the muscle. This tells me she has a joint issue on this side. The nerves that come from the neck also transverse out into the shoulder and out into the upper arm area. Let's just see how your shoulder joint motion is. As we come up and we get to the very top, that's uncomfortable there?
Yes, sir.
Okay, let's just see how the circumduction is. So when we get from 12 o'clock to about 3, you feel the restriction, correct? So this is joint capsule. This is a passive movement. This is not a muscle. So we compare the good side. Now that feels easy to you, is that right?
Yes, sir.
All right. And if we turn your arm all the way around from 12 to 3, that moves much better than the right one, correct?
That's right.
Okay. All right. All right, so let's start with a little instrumentation adjusting. All right. So the cervical instrument, the small fork fits the upper cervical area. So we're just going to glide from actually the upper thoracic, which is part of the physiological neck. We're just gliding up through here. We're tapping on all the facet capsules. Now, is there a sore area as we come up through here?
It's right near the top.
At the very top? Okay. All right. Now, you do pretty hard physical work where you're doing harvesting of pecans and
Picking up limbs.
okay. Now when I come down through here, that feels a little better, doesn't it?
Yes.
After that? Okay, I can feel that difference. That movement's better. Now at the very top through here, about C3, you got some restriction right there. I'll work on that in a second. And you feel that spot right there, don't you?
Yes.
So this is a muscular trigger point. It's an area where the muscle has a knot. This can come from overuse. So we're just going to take the instruments, we're just going to tap right over the trigger point. So when we're tapping, like a reflex, those impulses go up to your brain, back down to the muscles. It's going to help release the muscle. Okay, just relax. Good. All right. still pretty tight, but it's probably a little better, isn't it? I'm going to use a percussor on her shoulder to release some of the fascia and also the joint capsule. We have patients that have frozen shoulders that they can't move their arm past 90 degrees. Usually from underuse, the capsule will actually get scar tissue, and we use the percussor to help aid in returning that shoulder to better range of motion. Then we also do manipulation. That feels all right?
Yes, sir. It's good.
Now sore? Okay. So right now we're over the supraspinatus muscle. I'm going to go to the infraspinatus muscle. And we're going to go right over to the rhomboid muscle that attaches from the scapula to the spine. Okay, that did pretty good. I'm going to recheck your shoulder after that. Is that a little better, or is it all the same?
It's a little better.
A little better? Let's see how the circumduction did.
That's a little better.
A little better. Okay. All right, so let's go ahead and let's check your neck, on your back. So I'm just checking the movement first. What I'm doing, I'm checking the motion of the individual spinal bones. So every segment should bend and glide. And Andrea, when we look at your movement of your neck, just like these beads on the stick, when you bend your neck to the left and then back to the right, they all should bend. Well, in the upper part of your neck, you've got an area there that's restricted. So when I palpate, you can actually feel that, can't you?
Yes, sir.
So these areas that you have intervertebral disc in between every segment, and that helps keep the mobility there. There's also nerves that come out between the segments. So when these joints don't glide properly, the nerves that come from your neck also go out into the shoulder musculature. So when we get your neck to function better, it helps the nervous system function better, and it helps that shoulder function better. That's pretty sore there.
Yes.
Okay, so we're going to work on that right there. This is one of the worst spots for you. This is C2. So we're just going to stretch, do a little pre-cervical stretch. I'm going to stretch again. Okay, we're going to adjust you right here. Okay. That felt all right?
Yes. It's good. I become a humanoid again. Oh, that's...
There.
Ooh.
Have you had any headaches at all lately?
Yes. Last night.
And where were they at?
It's...
Through there. Okay. The reason why I asked you that, you didn't tell me that, but when I checked the upper part of your neck, right through here, right at your C1 occipital level, that is restricted. The muscles that connect to that area, they go over the top of the occipital nerve. And when those muscles get cramped, that's going to cause the referral pain up to the back of your head. Let's check this.
Oh.
Okay. So let's go ahead and adjust you there. Just laying up this way. We're going to stretch a little bit.
That's good.
All right, so let's just stretch a little bit. Okay, so now we're going to do a little traction because on your exam you had pain on compression. So we're going to distract. You're going to breathe through your nose, keep your teeth together, blow it out, let it relax. Breathe out, let it go, stretch. Breathe out, let it go. All right, that released pretty good. All right, so when I check you again, that movement's better. Probably still a little sore because things are inflamed a little bit.
Yes.
All right, let's move down just a little bit. All right, so we're going to adjust your shoulder because you got capture the restriction. So I'm going to adjust your shoulder inferior first. So just let your shoulder relax. Okay. I'm going to let your arm right to there. So we're going to adjust your shoulder out. Let your shoulder, just let the whole thing relax. We're going to bring it out this way. And stretch. Do that again, let it stretch. Okay, that adjusted pretty good. All right, so let's sit up looking out that way. Okay. Let's just recheck your neck movement. Turn left. All right, so you got at least 5 degrees better that way.
Yes.
5 degrees better that way. When we get you to here and compress you, do you feel the pain is bad here? Not as bad?
Not as bad.
Okay. Let's see how the shoulder did. All right, so that feels better?
Yes.
Okay, let's see how the circumduction did. That's a lot better, isn't it?
That's a lot better.
From 12 o'clock to 3 o'clock, that's gliding a lot better. Okay, you also had another area that bothered you with your shoulder blade?
Yes.
All right, let's just do a little palpation on your rib cage. Turn this way. You're gonna turn your head to the left. You're gonna let your head fall over this way. Just let it relax that way. So what we're gonna do, we're just gonna palpate her rib cage, isolate the area. When we get to about there, right through there, you got some restriction there. Let's compare it to the other side. Go to the right, let it fall over. That's kind of tight too, isn't it? Right there. That may be even worse than the other side. There. Okay, so we got T2 ribs are restricted. So let's adjust that. Let's bring your feet around this way. We've got cross your arms over that pillow. Just like that. You're just going to lay back. Okay, breathe in deep. Blow your air out. Blow it all out. It all moves pretty good. Good. Okay, come on up. All right, let's turn back out this way. Okay. All right, does that feel a little better?
Yes, it's feel better.
Okay, awesome. I'm Dr. James Nessing, your Macon, Georgia chiropractor. Thanks for watching today.